In tonight's Health Watch, mental health issues have long carried a severe stigma, and that's even true when it comes to children.
Few kids receive the treatment and services they need. Dr. Mack is here to tell us the American Academy of Pediatrics wants to make a change to that. Doctor.
That's right, guys, and this is not a small problem. Studies estimate that 1 in every 5 children suffer from a mental disorder such as anxiety and depression, and that could impact their health into adulthood, not to mention how those issues impair performance at school. It's time for a change. 18-year-old Kennedy Campbell has been dealing with anxiety since she was in daycare at age 3.
I didn't talk to anybody for 6 months, so they thought I was just really shy.
Her anxiety would leave her unable to speak. Doctors finally diagnosed her with an anxiety disorder known as selective mutism.
Talking is like overwhelming, and a lot of people with this disorder don't speak outside of the home.
It would have been helpful if the doctors had diagnosed her earlier.
Now the American Academy of Pediatrics is releasing a new report that provides pediatricians with guidance on how to help children with mental health challenges.
There is a huge shortage of child and adolescent psychiatrists and increasing prevalence of these problems. We can help play a more effective role so that more children get recognized and into treatment.
The report calls on pediatricians to recognize and address trauma and other threats to children's mental health. Dr. Corey Green is a pediatrician at New York Presbyterian Weill Cornell.
The big disorders right now that are more prevalent and probably within the scope of a pediatrician are things like ADHD, attention deficit hyperactivity disorder, anxiety, depression.
Kennedy founded Arts for Anxiety, which encourages people to use the arts to help with their symptoms.
I feel very happy that I can inspire children and let them know that they're not alone dealing with this anxiety, because I felt alone.
She also receives counseling and therapy, which she says has helped her overcome her anxiety and find her voice. Now, for a long time, mental health problems weren't thought to affect many children. Now we know that everything from anxiety to bipolar disorder to depression affects kids. And severe depression is a known contributor to the rising rate of teen suicide. And what's important about this, too, is that there are good treatments for all of these conditions, everything from talk therapy to medication. But the key is, you got to get the kids into the treatment. You got to get rid of that stigma and get them into the treatment.
Yes, the help is there.
Exactly.
Thank you,
What a
Doctor.
journey she's had. She's on stage.
Isn't that amazing?
It's a great.
Not bad.
Thank you, Dr. Mack.
Yep.